Assalamu alaikum. So here, this is the project title of Dr. Sendy Physical Health Center. The team are Dr. Ibrahim, Dr. Khulud, Dr. Sendy, Miss Amani, and Miss Mariam. So
you are all welcome.
The project definition: Dr. Sendy's Physical Health Center is a specialized center for women's health in Kuwait that meets the unique needs of women throughout each phase of their life: active childbearing years, pregnancy, and postpartum. So the DSPH Center combines quality health care with luxurious level to all clients and provide unparalleled health and wellness support from our multi-professional team.
Excellent.
The scope of organization. So here is the services. Our devotion to women's health and wellness start with providing the care we need, or the patient, the female needs, from carrying your first child to entering menopause, the needs of every woman, no matter what stage of their life, very greatly due to the wide range of conditions that it can happen to the women's health. So physical therapy programs is already provided here, focused on individual treatment for our current or for the female's current life stage and needs. So the medical services provided: physiotherapy for gynecological conditions like the urinary incontinence, pelvic organ prolapse, chronic pelvic pain, women's health conditions like obesity management, antenatal classes and education, postnatal care. There's other conditions also being managed by our center: post-operative care, low back pain, sacroiliac pain, coccygeus, chronic pelvic pain, lymphedema, and breast cancer care. These are some of the services we're providing. The physiotherapy, home and health. We're going to provide also in the future a psychological support service, home care, nutrition, and spa and yoga. Our vision: to be the first comprehensive women's health physical therapy center in Kuwait, providing a high-valued health care to all women in luxurious surroundings. And the mission: to develop the first comprehensive center of excellency for women's physical health improvement in Kuwait.
Yes, we said in mission to provide the healthcare services specialized in physiotherapy, as we edited it before. Okay, next.
The goals. So our goal, the first goal, is to establish the setting of the center. The objective: we're going to do this through finding the better location of the center, infrastructure, and installation of the equipment, or hiring the staff, the physician, the physiotherapist, nutrition, counselor, nurses, midwives, lactation consultant, and administration, or the frontliners. In the goal number 2, we're going to establish a unique physiotherapy center that provide the best support in women's health service in Kuwait. And this is going to be through a short-term goal, which is establish antenatal and postnatal programs in different women's health services, aiming to see like 10 to 15 patients a day. And this is going to be our aim within the first 6 months. The midterm goal is developing an effective obesity management program. So this is going to be introduced as a new service later that meets different lifestyle needs of women within 1 year. And then the long term, establishing an electronic platform for collaboration, care, planning, and monitoring, like our design own app for the center within 2 years. And goal number 3 is marketing.
Excellent for the last objectives, that they are smart. So we hope to edit the last slide at the goals to make goals smart too. Okay? Okay, next.
The tactics for the first object of goal number 2, we choose this because it's like more focused with the center: to implement antenatal and postnatal care, pelvic floor disorders, and BT programs, or physiotherapy programs, within the first 3 months, with the capacity of 15 to 20 patients a day. And then to create a referral system through cooperation with different hospitals, from the physicians, obstetricians, marketing campaign to introduce DSPH Center to the community, and we're going to design a special packages loyalty program to all the beneficiaries.
Good.
Okay, this is Dr. Ibrahim's part. Thank you.
Thanks, Dr. Sendy. Welcome, Dr. Ibrahim.
شكرا يا باشا. So my role is going to address the market management, and when it comes to the macro environment, we have to address the issues of PESTEL analysis.
Yes.
Politically, setting up a center in Kuwait, we know that.
Dr. Sandy, please bring back the PESTEL slide, please.
Okay, sorry, something happened here. Okay, wait.
No problem. No
I'm,
problem.
I'm just gonna.
So on the macro environment, Kuwait politically is more or less stable and one of the best Gulf countries supporting the private healthcare. Economically, Kuwait has high gross domestic product, GBD per person, and also it has a strong currency.
By the way, it gives me sort to send my deepest condolences about the death of the Prince of Kuwait.
Of course,
Thank you
was
so
a
much.
very good leader. And
From your point of view, Dr. Ibrahim, what is the best strongest point for PESTEL of Dr. Sendy Center, and what is the weakness point?
now we're talking about the internal environment.
I am talking about PESTEL, yeah, from the points of political, economical, ecological, and so on. The PESTEL,
Right.
what is the best point we can resembling it as a strength point, and which one resembling a weakness point in PESTEL? What with you and what against
weak
your
point,
project?
I would say the political issues. Sometimes the stability in the
Yes.
you know is stability in the Gulf area might be a problem in the future. We don't know. And the strongest one is that this country has a good income, good revenue, and in the same time, because it is a specialized center, obesity would be a great winner for this business. If we focus
Okay,
on
next.
the obesity. So, carry back to the social aspect, we know that 40% of the population roughly are obese, and however, women have a great attention to their lifestyle. So they pay great attention to their body image and fitness.
Okay,
Technology,
Dr. Ibrahim, from your
yeah.
point of view about the five forces of Porter, what are the most important and the highest pressure of forces from your Porter analysis on your project? Choose two forces from the five forces having a great impact on your project.
The first point is about the buyers. It is the first dedicated center for women, which provides the wide range of business services which are devoted to women, including the pelvic floor exercises and antenatal classes. That is one of the strongest points. When it comes to threads, always threads and the degree of rivalry, these are the weak point. But however, this center is a unique center. So it is like starting in a blue ocean. So the rivalry and the substitution or the new entrance will be facing a big giant center, or they will move onto red sea water. So this is
Excellent, Dr. Ibrahim. Next,
more advantages.
please bring your SWOT analysis. Yes,
When it comes
from
to
your opinion, Dr. Ibrahim,
yeah,
what is your best and the most strong strength point, and what is the most important weakness point?
Again, the strong point, it is the first kind of center in Kuwait, and there are lack of competitors when it comes to the field of the services this center we're going to provide. The weak point is the setting up the financial burden, setting up the business, a new business, and of course you have to fight your way for marketing to get this new business known in Kuwait.
Yes, excellent. Next.
When it comes to the performance management, strategic planning, or PMSP,
yes.
Elements we look at or to consider are it is a new business. We have to win money. We have to make a capital gain. So the
Yes.
elements.
Kindly, Dr. Ibrahim, I need in PMSP planning, as I told you before, an example for competitor, benchmarking competitor, doing something, and what you will do against it to overcome it.
Okay, let me discuss first these elements. The elements we need to gain money. We need to monitor our achievement, monitor the employer effectiveness and productivity and patient satisfaction. These are the elements we're looking at to compare between us and the other services. And this is the comparison between our proposed center and already established center in Kuwait, which is more or less providing physical health to population there. When it comes to services, our is profitable organization. The other center is non-profitable organization. It is generalist physiotherapy. Ours will be women devoted health center, and we focus on antenatal and postnatal part of physiotherapy. However, the other the driver would be involved in occupational therapy. We
okay, next.
Pay attention. Okay, I move on to my other colleague.
Okay, thank you, Dr. Ibrahim.
Thank you.
Welcome, Dr. Khulud. Kindly, Dr. Khulud, try to open your mic to hear you. Dr. Khulud, you hear us? I think she has a problem. Okay, to save our time, could any one of you proceed and continue till Dr. Khulud can fix her problem?
Okay, so in the operational planning for execution our macro operation, first of all, we're going to talk about the system itself, the whole thing, establishing the first women health physical therapy center of its kind for devoted mainly for women health. And we're going to divide this to a big process like launching the services, antenatal, postnatal, pelvic floor disorders, the nutrition or obesity management, and other services mentioned before. And the macro process will be divided into other processes like hiring the medical staff, set all required specifications for each service provided, request the quotations for to getting the equipment needed and settling the whole center. And then sub-process is designing and discuss different plans of treatment, how we're going to provide the service. We're going to launch educational channels for the patients in the centers, a leaflet and things educational to acquire them more about our services. And then the activity to agree to all of the plan of the treatment and the services provided and divided all this to a small tasks. So start the actual operation of the center, getting more patients through referral or telemedicine, using all possible social media channels, agreed standard referral template, and negotiations with the obstetricians for referring more patients.
Yes, okay, great. Next.
So we go to the execution of the plan: who, what, where, when, why, and how. So who, the physiotherapist, obstetrician, the nurses, so the staff itself. And what, we're going to start providing the women health services, where in DSPH, Dr. Sendy Physical Therapy Physical Health Center in Kuwait. The due date of it was the 5th of Jan 2022. And why? Because the lack of the service in the market, we're one of the kind. And how? Start getting referral from the hospital. We want to get more patients, start the service with the discounted packages, inquire the patients about the loyalty programs, and do agreements with other hospitals.
Okay, thanks. Dr. Khulud, could you try now the sound? If it's good, okay. If you still have a problem,
السلام
okay, no
عليكم
problem.
دكتور. أنا عندي
وعليك
الصوت
السلام
ما
عليكم.
واضح أبدا والبرنامج بيفصل
Yes,
كل شوية.
yes, we are hearing
الصوت
you
واضح
now well.
عندك؟
Yes, it's obvious now. Try to continue and we will hear you. We are hearing you. Thank you, Dr. Sandy. Welcome, Dr. Khulud. Go on.
ألو.
Yes, we are hearing you, Dr. Khulud. Go on. Dr. Khulud, you hear us?
ألو.
Yes, you can go on, Dr. On. Okay, I think the problem is still persisting with Dr. Khulud. So, Dr. Cindy, you can proceed. No problem, Dr. Khulud, never mind. Okay, go on and continue, Dr. Cindy.
Okay, so the step one is establishing the project. Yes. Okay, Dr. Khulud.
Okay, Dr. Khulud, no problem at all. We understood your problem. So Dr. Sandy will proceed not to make pressure on you for the network issue. Okay, continue, Dr. Sandy, to save our time.
Okay, so the step number one is establishing the project, the physical health center. Number two is identifying the customer. So we divided the customer into external customer, hidden customer, internal customers. For the external customer, there are the patients, so the maternity patient, obesity and diet disorder patients, post-operative care, or the patients even being visited at home. The hidden customer, like we know that the paramedics and so, but for us, we're not going to use any paramedics, so I've choose medical representative or private staff driver. Internal customer is the staff itself, the like obstetrician, gynecology, the physiotherapist, nurses, the frontliners, so the staff in the center.
Yes, but I want to ask a question, please. You bought within the internal customers, obstetric doctors and gynecologists. Would you hire gynecologist and obstetric doctors within your physiotherapy center?
Yes, of course, we have to have one, at least one.
Okay.
Okay.
Okay, this will be a good added value. Okay, next.
So step number three, discover the customer needs. So we would discover the customer needs through surveys or even focus group questionnaire and follow-up calls. Like, how was the service? How could we have done better to improve your experience? Patient satisfaction value. What would you expect from our service? Would you recommend our service to a friend or a family member? So as a result, we are trying to deliver an awesome customer experience to meet the patient expectation level and exceed even more.
Excellent. Next.
Also, we want to encourage the vital few. Like the 80% of the revenue usually comes from it's a luxurious center, so we're going to have more of A-class patients. So why would they love to come to us? We're more confidential, we have confidentiality, high privacy, no waiting time, luxurious environment, dedicated female staff only when required, no waiting time, even better than other hospital or even the MOIH hospital, which they have some of these services. Loyalty program, continuous follow-ups with them. We can offer online consultations and even home visits.
Excellent. Next.
Developing the service. So it's the first center, a women health center in Kuwait. So we want to highlight the importance of it in antenatal and postnatal classes. Like we would design packages, design leaflet, educational channels, personal account registration on the mobile applications that is specially designed for the center. Patient can review their acquired to do exercises, their appointment. We would send them what's their feedback, patient questionnaire, and even we are applying infection control measure and safety measure against COVID-19 and other stuff.
Excellent. Next.
Okay, so developing the process, I think it's
like what we said before in operational planning.
Yes.
Step number 6.
Operational plan.
Yes, this is for step 5.
Yes.
What about step 6?
The KPIs, it should be with Miss Amani. I don't know if she's with us.
Yeah, I think she is not present now. Sam Tahir with you or not?
Sorry?
Okay, this is related. Okay, go on, Miss Amani. You can take the mic.
السلام عليكم.
وعليكم السلام ورحمة الله. Go on, Mr. Amin.
We are in step
Go on, Mrs.
Okay.
Amin. Yes.
Step 6. Okay. Step 6 is quality control, KPIs, quality of services. To measure efficiency of the service, staff should be up to the professional level and achieving the high standards of safety and infections control. Patient satisfaction survey, reviews, and referral through a friend, family member, and 360-degree team feedback, team keeping, and communication, complaints, and sick leave.
Excellent. Next.
Sorry, this is the type of the patient survey form that we would like to implement in our center.
Very good. Very good. Excellent work. Thank you. Next. What is the job that you made the job announcement for?
PT.
Yes. Kindly, Miss Amani, loud your voice. Yes.
Okay, sorry.
Continue.
We are hiring female physiotherapy required, PT 05.
Why did you make it 05?
Because it's a specialist we need.
This means that in the chain of command, 4 degrees up above here. For example, if you are the manager and you will be physiotherapist 1, this means you will have under level, then level 3, then 4. Then when she can see this job announcement, she will know that she will be in the 5th grade, in the managerial grade.
Yes. Yes.
Okay.
Okay. For a new
okay, you don't have to
prestigious physical.
Okay, you don't have to read off all of it. Next slide, please.
It is my turn now. The balance scorecard. We will start with the financial. it is on
Kindly introduce yourself, please.
Mariam Ahmed.
You are most welcome. You are most
Thank you.
welcome. Yes.
Yeah.
Yes.
The balance scorecard, it's included in 4 departments. The first one, financial. It's according about gross income and overhead cost and the staff salary.
From
and
your
the
point,
bill.
Dr. Maria, what is
Yes.
your strongest card and what is your weakest card?
I think the strongest one, it is the customers.
Yes.
I think. And
And
the
the
weakest, I think sometimes maybe it's internal business. It
Okay,
is depend.
next.
About now, I will talk about Kotter Model.
Yes. What is
as
the
we
change
said,
that you would apply a Kotter model on it?
We have to make change on the what is the market need and what the staff make strong staff. This is included, and how make the quick job.
Okay.
And yes.
Okay.
And
Next, please.
encourage
We
the
have
people.
we have only about 3 minutes left before the
About
time will out for the project. Okay. Next slide,
about
please.
IDDL model.
Yes.
IDDL. Yeah. It is talk
Yes,
about.
what is the training that you will make?
Sorry.
What is the training that you will make? The name, the title of the training program.
Role of physiotherapy and management of pelvic floor.
Okay, the role of physiotherapy. Okay, next, how you will apply Kirkpatrick on it, please?
Kirkpatrick, it's including about the reaction and the learning and the behavior and the result. We have reaction talk about what do you think of the training and were you satisfied with it, and how would you rate your satisfaction and happiness of the training given.
Okay, good. I got it.
Yeah.
Next
Yeah,
slide,
by
please.
survey and question, and it is that all these slides.
Thank you all. Very good presentation. Excellent project. Best wishes for you and the best regards for you. We hope to see this project is actually implemented in Kuwait. And we hope to attend and visit it when it will be turned into real. Thank you so much.
Thank you.
Thank you all.
Muhammad.
Thank you.